Hello everyone, this is Homeopathy Heals and myself Dr. Zahir. I hereby welcome you all. A very good afternoon, and this Sunday, a very special Sunday, we are back again with episode 29 of our Instagram live guest talk with Homeopathy Heals, and we've been continuously trying to create an awareness, educate the students, the masses regarding the homeopathy, regarding the scope and limitations of homeopathy. And today's session is special. I mean, and it will touch, I hope it will touch each and every one of us, because we'll be discussing about how to start a homeopathic practice. I'm sure whenever we are intern or final year students, we are always in a dilemma what to do, what not to do. And you all might be having a lot of questions, those who are running their clinics, how to up their business, and how can they can move forward. And today with us we have a very very special guest. I would like to join him first and then I'll introduce him, and I'm sure you all must be knowing about him. Always high on the homeopathy, and definitely this session is gonna work for all of us, and I'm very excited. Let's wait till he joins. And he is very good afternoon, boss. Hello. Can you hear me, boss? Okay, there might be some trouble with Instagram. Please, Instagram, fix this. I would like to tell you that back to back we have other big celebrities, I must say, stalwarts coming to next Sunday and next to next Sunday. So stay tuned with us and keep on learning whatsoever you can learn, you can gain from them. Just don't learn from their journey or learn from their short lessons. Very good afternoon, boss.
Very good afternoon. How are you?
I'm so good. I'm so good. I'm even good after seeing you here. Thank you so much for your valuable time and the amount of effort you are putting in educating budding homeopaths towards the homeopathy, that too making it real fun. I'm your recent fan, I must say.
Okay, thank you.
For those, we'll start. But before we'll start, I would like to introduce you. He is none other than, I call him the Dr. Raj Bondre. I call him the Dr. Raj Bondre because he has always come up with, fun ideas to learn homeopathy. He never make homeopathy a boring subject or a subject which you have to make a rectified, or you have to remember it. He always uses repertory, various kind of repertories, as you might have seen in this video. He is MD Homeopathy and a gold medalist, and he has done his PGDMS from Symbiosis Pune. He is also a professor at GM Homeopathic Medical College Jalna, and he's PG guide too. So he is owning two clinics, yes, one in Jalna and one in Aurangabad, and he is the founder of world's first robotic case-taking software. And today he is here with us to talk about how to start homeopathic practice, and that too in a rural area. Why this rural area? Why not an urban area as well? You tell me first why we have selected this topic.
Right. So let's start in this way. See, whenever a boy or a girl takes admission, is my voice okay or is it getting echo? Okay. So whenever a boy or a student gets admission in BHMS, the aim of getting admission is a different thing. But after getting admission, 5%, 10% people really go as an homeopath. And this is a difficult scenario which needs to be changed. And this can only be changed by getting more people into remote areas. You'll see in urban areas, many people practice homeopathy, they do well worth with it, and people are aware there with homeopathy. if we want to spread homeopathy, it should be with the rural area. The general practitioner should also get 5-10 patients every day, and they should also be able to prescribe. They should be also to get good results in with our homeopathy. So this is the fact that we need to strive this to make it more popular. It should go in vast arena in the rural areas also. You are not audible.
Okay, so I would like to start asking questions without wasting a minute. I would request all the audience, please drop all your questions, be it very intellectual, be it stupid, be it silly, because the Dr. Raj Bondre was is here to answer all of them, irrespective of all judgments and what we will think about it. It's not like that. You ask all your questions, drop it in the comment section. I'll start with the first question. My first question is how to start homeopathic practice.
Right,
What
see.
should be the vision, goals, requirements, and how?
See, to become a homeopathy doctor, the first and most important thing, should I tell everyone? Is everyone interested? So, the most important thing is, my dear friends, is the burning desire. And the desire, the burning flame to be a homeopathy doctor, whatever the scenario it may be. Your family people will tell you that अपने घर में खाने का परेशानी हो जाएगा. फिर your friends will tell भाई तेरे पास patient नहीं आएगा. Your college people, your peers will tell तेरे को होम्योपैथी दवाई मिलेगा कैसा, वो पेशेंट कुछ बोलेंगे नहीं तेरे को, कैसा करेगा तू. So इतना कुछ होने के बाद भी there should be a burning desire that you want to be a homeopath at a point, and you want to get everything from it as a source. May it be your bread and butter or the other things. And after that, when you have decided this thing, you need to learn it, my dear friends. See, there is a scenario where you people become general practitioners. See, and when you want to become general practitioner, you go to a general practitioner and you learn saline Redeka, vagara, vagara. You learn all those things. But when you want to be a homeopath, you should be able to learn the average things first. It's the game of common man. And unless and until you know the common diseases, you know the common remedies of the common disease, you are not going to thrive. You are not going to become a doctor. You need to come out of the fantasy world, out of the fantasy of becoming a homeopath doctor. Yeah, this is not the thing. You are going to become a doctor first, and for that, your average things, average remedies, average diseases, common people, you should be able to understand the common ailments. Then how to tackle the fever, how to tackle the cough, how to tackle the colic, diarrhea, and you should be very perfect in those common remedies. And then only you will become first a family doctor, a family physician. And then after that, the people will have some faith in you, and then people will come with the other ailments, the chronic ailments, and then you can prescribe for the different difficult diseases. So you need to chalk down your strengths, your weakness, and then analyze it, and then work on it, and then proceed towards your goal.
Very true, boss. Okay, so although my question seems very funny, but still I would like to ask, although I know the importance of hard work, perseverance, the determination, that's true. But still, my second funny question is how to get successful in less time.
Yes, yes. Yes. So, so the fact is, my dear friends, uh, anyone can do it, and it is just about your uh, it is just about your dedication and your disciplined hard work with smart work. Whatever aim you, if we are aiming to become a homeopath, we need to know what are the basic necessities to become a good homeopath, and what is the time requirement. You need to get some case studies. You need to get some case studies of some successful doctors near you, in social media, then other cities, and get the case studies of them. How did they did it? What was the time span? How was their clinic settled? And in how many years they achieved this thing? And if we want to lower our time scale to achieve those things, we need to increase our efforts. We need to multiply our efforts, our discipline, our skill sets, our uh, daily things, whichever we do, and then we can multiply our results and decrease our time to get success. And there are various things which are needed to become that successful. You need to be, first and most important thing is, you need to be honest with yourself. See, a patient comes. Yesterday I got a phone call. Doctor साहब ये 24 mm का kidney stone है. So you need to do justice to patient. आप लोगों को अपना limit मालूम चाहिए. You cannot destroy patient's life in your fantasy. कि मैं आओ तुम लोग मैं ठीक करके दूंगा, ऐसा नहीं है. You should know your limits. Instead of that, refer that patient for surgery, because in long term it may spoil the patient's renal system, and then he after 10 years he may be seen as a renal failure patient. So we should analyze our patient situation. We should be at his place. If he tells me, डॉक्टर साहब मेरे को इतना भयंकर दर्द हो रहा है, मेरे को इधर बैठ नहीं सकता मैं, and you are just fantasizing here, you need to be very perfect, precise. He is giving some sort of time, and he's investing his time, he's giving his time, money to you. We need to be very accountable. We need to give justice to him. We need to give a perfect prescription so that he comes out of it, and then our time of success gets reduced. In less time we can achieve more.
That's very true. Matlab, I will definitely agree, because whatever I teach or preach here on homeopathy heals, I always ask all budding homeopaths to know their limitations. And once they know their limitations, the scope will get definitely widened.
Right.
And we small homeopaths have big egos actually. And I've seen it in the fraternity. Honestly, I'm saying this on a social platform. Small homeopaths have big egos. They're not ready to accept. They're not ready to accept their limitations. And for for satisfying their ego, they can play with, even patients' life. That's very true. It touched my heart. Now, my third very silly question, but you have to answer, is how to get 30 or more than 30 patients per day in OPD.
See,
no judgments. I'm asking you all to drop your comments, questions in comment sections, because I'm also asking, very important. All those things funny, silly, but still, boss is here to answer them all.
See, when your practice grows and when you see common ailments, now there are various patients. You have some acute cases, you have some chronic cases, and when you give good results, you get various patients from various people. Now there are some God figures in your life, and you can say them, they are angels for you. I have some angels like that in public. I think there is God, they are God for me. If they find someone in the road and someone talks to them, डॉक्टर साहब ये इसका ऐसा सुना, they directly call me. डॉक्टर साहब ऐसा होगा क्या अपने से ये काम? तो ऐसे देखो आप लोग रिपोर्ट वगैरह भेजो, फिर अपन देखते होगा तो अपन करेंगे काम. फिर देन समवन से, डॉक्टर साहब इसका ऐसा है ना, जरा गरीब परिस्थिति है सब, ठीक है अपन कर लेंगे, आप भेज दो. So these are angels and we should find these angels. हम लोग को ऐसे अगर 10-20 एंजल मिल गए लाइफ में, तो हमारे को और कुछ भी करने का जरूरत नहीं. तो एंड दिस वी कैन डू बाय जस्ट फोकसिंग ऑन आवर वर्क, our style of work, be empathetic to the patient, and understanding the patient, his situation, his financial situation, his emotional situation, his disease situation, and then just prescribing on that.
That's very true. I mean, we have also experienced this, but calling them as patient angel It's something very different I learned today. So
Right,
we'll pick up
right.
some of the questions from the audience. There's a question, boss, is there any scope of homeopathy in surgery?
In surgery, see various you can find in Pune also where you practice. Various surgeon and other people they use calendula and other medicines post surgery for various diseases. Also, we have various remedies in us with us. If someone has gas trouble after surgery, we have various remedies. If there is burning pain, if there is stitching pain after surgery, we have remedies. After amputation, if there is pain, we have remedies. So there is scope, but we should judge that scope with the patient's viability, his clinical condition, his vitals, and then only if it is okay for the patient's condition to get prescribed by a homeopath, then only we should enter in it.
Okay. The next question is, can we become gynecologist in MD homeopathy?
So you can become a gynecologist just by your practice, not by your degree. You can become see I someone can take lot of gynec cases, just treat fibroid, and then all the menstrual related issue, all the female complaints, and he can just focus on such area, study that area, practice on such patients, get some good results, and you'll get a name for that in the market. It should get by patients mouth, and then you can become by not you cannot label yourself legally, because you are more than that. You should not label to a single thing.
The next question is, how to select a simillimum while taking case itself, because patient wants relief in first prescription, and coming to a simillimum, we need to analyze the case, which is not possible sitting in front of patient and using repertory.
See, it is possible, but for example, if you see Neeraj Chopra, he has done he has made a record and won a gold medal for us. This is gold medal. Every patient is gold medal for us, and for that gold medal, in that time, in that short span of time, we need to prescribe. For this thing, we need to practice. We need to practice our materia, our repertory, our cases, and after some 100 cases, 1,000 cases, 2,000 cases, you will be able to prescribe, I guarantee you. And for that, you should have a guru, have a coach, have a master. Under them, you can learn various techniques. Some people you can learn repertory, from some people you can learn the case technique, you can learn the prescribing technique. Learn from various masters. जिसके पास जो अच्छा है वो सीख के आ जाओ, और फिर वैसा ही अपन लोग इस्तेमाल कर सकते हैं by using your own art, and then you can do everything in less time.
There's a question. There are various things which demotivates us on being on a right path. What keeps you going? She asked my question.
Right, right. So this is a very interesting thing. So my dear friend, this is all about knowing ourselves. See, there is a technique called SWOT analysis. So where you can write down your strength, your weakness, your opportunities, your threats, and other types of techniques where you can analyze on paper about all the things, whatever you want in your life, your short-term goals, your long-term goals, and your everyday habits. And you should focus on just improving yourself every day in and out. And by that way, we can remove our demotivating things and just focus on our aim, because our aim is more important than this demotivating things. If you have a focus, you these demotivating things will not bother to you. If you have a clear aim in your mind, and if you have your task set for a day, कि आज मैं इतना पढ़ूंगा, मैं आज ये केस सॉल्व करूंगा, मैं ऐसा करूंगा, मैं ये करूंगा, then you don't have time for this demotivating things. And you just need to focus your small habits by which you can improve day in.
Okay. There's a question. In rural area, patient don't want to give the full case, as it is very time consuming, and they
Right.
carry a chronic multiple disease and doesn't want to follow up and does not want to pay also. So how you deal with that?
Right. Very interesting. For this thing, you need to first tell them, देखो भाई, तुम लोग मतलब आपको बीमारी है, ठीक है, अब ये बीमारी मुझे ठीक करना है तो मुझे इस पे काम करना पड़ेगा। अब अच्छा काम करने के लिए थोड़ा वक्त देना जरूरी पड़ता है। अगर आप लोग वक्त नहीं देंगे तो मैं काम कैसे करूंगा? यू शुड honestly tell the condition to them, and there some, I'll tell you, 99% will understand the thing, and then work on it diligently, sincerely, and show the result. My dear friends, only your action will speak, your results will speak. And your result, if you, I'll tell you, I all my morning OPD is from rural area, from 100 kilometer. Some people come to me from 100 kilometer. Their traveling time is 3 hours, 4 hours. They pay more to come to me than my fees. So it is a different situation. And rural people are very honest people. You will get very good cases, and in those cases you should not be very biased. मुझे ऐसा बताओ कि आपको ऐसा लगता है मेरी बीवी मुझे बहुत तकलीफ देती है, डेल्यूजन, परसिक्यूट, ऐसा ऐसा सब लोग मिलेगा तुमको, बट तुम ऐसा मन में ठान के लेंगे कि मुझे यही चाहिए फिर मैं ही दवाई दूंगा, ऐसा नहीं होगा। यू शुड प्रिस्क्राइब ऑन वट एवर ही सेज। उसने बोला मुझे आलू खाने से तकलीफ होता है, if he is saying it is important, you should focus on whatever you are able to get. Whatever he says, that is important to you. What you feel is not more important. Just be there and just be with that patient and just analyze whatever you get in that scenario. If you get, वो बोल रहा है मुझे डॉक्टर साहब ऐसा पित्त आता है, आर्टिकेरिया होता है और मुझे खट्टा बहुत ज्यादा पसंद है, give him the remedy. Don't think about anything other, and then you will feel that yes, this was his remedy. And in this way we can get the patients better.
There's a question: can we start our practice from few medicines? And if yes, what are those medicines?
Very interesting question. So I'll tell you, I had first only a small ऐसे टिफिन जैसा डब्बा, उसमें 8-10 दवाई था मेरा, और फिर मैं उसमें से 4-5 आर्सेनिक एल्बम, यूफ्रेशिया, ऐसे कुछ 3 दवाई। Whatever patient, see, if you are a new person, you may not have 100 patients, 5,000 patients, 6,000. You are having 2-4 patients, so you need to have just that remedies with you. अगर तुम्हारे घर में किसी को सर्दी होते रहता है तो तुम इलियम सिपा, यूफ्रेशिया, आर्सेनिक, ये डलका मारा, ये सब रखो। अगर तुम्हारे पास पेशेंट आने वाले जॉइंट पेन के पास, तो तुम वही दवाई रखो। एंड देन आई विल टेल यू one habit which will make you a good homeopath. Just start collecting medicines. Okay, from whenever you get some money, start collecting medicine. Whenever you have some extra thing, start collecting medicine. Order medicines from anywhere in the world. Explore the pharmacies, explore the opportunities, and get all those medicine. Unless and until आपके पास दवाई है, आप लोग क्या देंगे फिर पेशेंट को? आपको मालूम ही नहीं वो दवाई है, इल सीरम है, उधर और बहुत सारी दवाई आपको मालूम ही नहीं, अपन देंगे कब फिर उनको? और अगर आपको मिल गया, समझो आपने एक पेशेंट, some patient comes to you and he says something very very interesting, and you found out the remedy, you know it is the remedy, and you don't get the remedy 500 kilometers, तो फिर आपका क्या फायदा? तो वो दवाई अपने पास चाहिए, इसलिए अभी गेट योर मेडिसिन बैंक रेडी विथ यू।
Okay. There's so many questions from audience. When will I ask my questions? Still will continue. How to face criticism from allopaths?
Right. Very very interesting. See, criticism is a part of journey, and unless and until you are getting criticized, you are not a successful person. So just write down those criticism and work on it. If it is a real thing, and if it is a bad thing, just avoid. Don't look at them, overlook them. Avoidance is the best therapy. Why are you worried if they are not saying in front of you? you need not to worry. Just let them speak, let anyone speak about you. You just focus on your lacunas, your aim, your focus. मैदान इतना बड़ा है ना भागने को, बस तुम खुद 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 भागो. ऐसा दूसरा कुछ बोल रहा है, वो खींच रहा है, खींचने दो, तुम भागो तो सही, भागो तो सही. वो पकड़ में ही नहीं आओगे तुम इसके.
My God, I got goosebumps. That was so motivating. Okay,
Right, right.
there's a question. Boss, do you use rare medicines in homeopathy, and are they useful in clinical practice?
Yes, they are useful, but see, it depends upon, suppose for example I get lot of renal failure cases. Okay, so I ordered all the medicines. I have methylene blue with me. Uh, I have very interesting remedies for renal failure. So like cox is one of the thing, and they are useful, but unless and until you will get that type of patient, जब तक फिर आप वो पड़े रहेगा बस आपके पास. And try to get बेस्ट इन पॉलीक्रेस्ट. वही आपको दुनिया में कुछ देने वाला है. वो रेयर 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 रेयर, इट इज रेयर. कॉमन, इट इज कॉमन. कॉमन ही आपको राजा बनाएगा, कॉमन ही आपको आगे ले जाएगा. जस्ट बी एवरेज फर्स्ट.
Am I audible, boss?
Yes, you are audible. Am I audible?
You are not audible. You are not audible.
Okay, but the connection is right. How is it now? How is it now? No. The connection is right. Is it good now?
Both are audible. I think you're not audible to me. Okay. Okay. The next question is, what is the best potency for acute cases?
Yeah, acute cases. See, acute case, the scenario is upon the severity of symptoms. First, for example, if I get a fever patient और वो बोल रहा है डॉक्टर साहब मेरे को ऐसे एक एक घंटे को प्यास लग रहा है, इतना भयंकर 104 बुखार आ रहा है मेरे को, और आपको दवाई भी एकदम परफेक्ट मिला है. So I start with 200 potency, and if he gets better, I drop it. If he doesn't get better, I increase the potency to 1M and to the frequent repetition. So this is the thing.
The next question is, should we practice homeopathy and allopathy both in the starting? Your count on this.
I didn't get you.
There's a question, can we start or can we practice homeopathy and allopathy both when we are starting the clinic?
अच्छा होगा पूछ लिया. तो कैसा है देखो कि हम लोग है ना, एक ही चीज कुछ तो करना चाहिए, नहीं तो फिर आप लोगों का जिंदगी चला जाएगा पर कुछ होगा नहीं. आई हैव सीन मेनी ऑफ द पीपल, वो बोलते हैं मैं अभी पहले ऐसा कर लूंगा, फिर मैं क्या करूँ 10 साल में होम्योपैथी प्रैक्टिस शुरू करूंगा. इट इज नॉट पॉसिबल बिकॉज you have taken lot of efforts to become a general practitioner. वो भी ऐसा रात में तुम ऐसा चांदी में नहीं जाओगे. तो when you are taking lot of efforts to become a general practitioner, be the best general practitioner. Don't focus on homeopathy. And if you want to become a homeopath, become best homeopath. Don't focus on other things. Leave it aside. Focus on your aim. फिर नहीं हुआ, तुमने 2 साल दिए, 3 साल दिए, 4 साल दिए, then you can focus on other things. But if you are confident about your aim, you need to take efforts. And if you are taking efforts, you are not going to fail, my dear friends. You are going to achieve it. But just एक ही मन बना लो क्या करने का है.
Very true, very true. And I also agree with this because if you have done BHMS and you've been studying homeopathic subjects along with all the allied subjects, you should not practice the allopathy. We have so many big specialists, MD, MS surgeons. Let them practice their own. And even our medicine is so rational, so wide, and it has a lot of scope. So why don't we start with our own only? Starting, I've seen people practicing allopathy just because they want to give quick results to the patients. But what I believe that we get quick results with homeopathy as well.
Right, right.
Yeah. So there's another question. Does using radar in starting practice is good?
Anything you need, anything you use it, it is good. आपके पास कुछ भी नहीं है तो कुछ भी इस्तेमाल करो, फ्री करो, पायरेट करो. आई डोंट वाउच ऑन इट. जो भी है करो, बट होम्योपैथी करो. आप लोग शुरू कर दो बस.
Sir, radar people will be finding you out at this session, huh? They'll be behind you. That you are educating and advocating the free and pirated version of radar to everyone.
नहीं नहीं, भी करो. I'm not भाई इधर लोग वो हाउ स्टूडेंट विल बाय 1 लाख रुपीज सॉफ्टवेयर. इधर लोग पहले वो बीएचएमएस करने को परेशान है. दे आर वेरी मच, इट इज डिफिकल्ट सिनेरियो फॉर देम. You get anything and start using it. Unless and until you will use the used car, you cannot buy a new car. So practice.
There's another question. Boss, please tell about the concept of potency and how do we start in homeopathy?
See, it is a very big lecture. And if you had been in your first year, there was a book, Mandal and Mandal Pharmacy. For basic learners, there is a chapter, Posology. And there you can go and read. There you see fat guy, what potency, thin guy, what potency, heighted guy, what potency, intellectual guy, what potency, dumb guy, what potency. Start using that first. And acute case, what potency, chronic case, what potency, perfect case, then idiosyncrasy cases, what potency. Basic funda you can get there. And then when you'll see cases of various doctors, various prescription, real cases, then you can learn that thing. It is an art. You can learn it.
Okay, that's so true. There's a question, which is the best stream for MD homeopathy and which is best? Yeah, they're asking for the stream for MD homeopathy. Best stream for MD homeopathy.
Is best, my dear friends. Do MD in anything. Just focus on practicing. Get first, dekho, learning is one thing, and getting educated is one thing, and getting literate is one thing. You are just going to get literate after your PG, UG, certificate courses, had degree, that degree. But you need to learn and get educated. And you should know that thing, whatever you are learning. And you should be able to practice. You should be able to serve. And then you can say, I am an MD doctor or whatever doctor. So anything, whatever you like, you can do it. But do justice to it.
That's so true. Okay, there's so many questions. I hope you are not tired.
No, we can.
Yeah. There's a question. Nowadays, there are many external applications.
We can skip the questions like this college, vagara, vagara, MD. Because these are easy. Anybody can look it on internet.
Okay. Nowadays, there are many external applications like face wash, creams, lotions, and homeopathy. Should we practice with that also?
See, if you are a classical homeopath, you will not get time to write all these things because you are very much focused on the patient and you are very much busy in the case. You are not going to remember to write the soap or the face wash. Some people, I had before 2-3 years, one of the pharmacists kept some things in my clinic and they were as it is for 6 months. I didn't get time to look at them and to keep in my mind and to give it to patient. So it is not at all needed, my dear friends. It is just the remedy, just the patient and you and the remedy. That's all. You don't need any fantasy things. These are not the thing which a homeopath can give result, extensive, ekdam perfect result. Those are supplementary things. When you don't get anything, try those things. That may help.
Okay. There's a question. What about RTA cases, sir? If we practice homeopathy, then tetanus injection, dressings, should we do or should we refer to the hospital?
See, I don't do those things. Yeah, it is on you, but I think that you are not the person to do that thing. The qualified person for legally, see, there are some legal obligations to you. You should know your limits. You should read the CCH regulations. You should know your law you are governed with. If you are practicing Maharashtra, read laws of Maharashtra Council of Homeopathy, what you are allowed to do, what you are not allowed to do. You are getting a doctor. उधर जाके आपको किसी ने बोल दिया अरे आप पे मैं केस डाल दे तो आप ये कैसे कर रहे हो. So it is not a good scenario. You should know your limits. Don't do which are not written for you. Do those things which are written. आप लोग अपने को जो दिया है करने को लीगली वो करेंगे तो फिर भी आपको टाइम नहीं मिलेगा, जिंदगी चला जाएगा.
There's very one interesting question here. A student is asking, in the starting of clinic, what should be the consultation charges?
Very good, very good. See, what I feel is, you should, if you are become a doctor, a doctor should be easily available. अभी मेरे पास आने के लिए ऐसा नहीं है कि उसको इतना पैसा उसके जेब में होना चाहिए. You should charge according to the situation. If a person is not at all capable to pay, but he wants to visit you, तो उसने क्या करना चाहिए? It is not good thing that you are rejecting some people. I think you should be a doctor who charges a minimal thing which you require to survive. ऐसा पैसे लेके माड़ी में कहाँ जाने वाले हो अपन लोग. तो just whatever our needs are there, our basic needs that should get satisfied, and you can increase the number of patients then if you want to increase your money. Every state of patient should be able to approach you. Every class of patient, coming from low class to high class, everyone should come to you. You should be that type of doctor. कलेक्टर भी आना चाहिए, आमदार भी आना चाहिए, गरीब आदमी भी आना चाहिए.
That's so good. Boss, then there are so many homeopaths, those who are charging 5,000, 10,000 rupees.
Right. It is that thing because वो in a day every doctor has some limitations, right? He has 12 hours of time, 24 hours of time, 12 hours, 10 hours going sleep. He has to give time for his 8 hours family, and he has 8 hours just to earn his thing. And he cannot complete a task of getting 100 patients. So to reduce that number, he has to increase his fees. But it is upon everyone's scenario. Those people do some social responsibility. They serve once in a day a week as a free clinic. I have once in a day where I treat some diseases free of cost, nothing, zero money for me, zero money for medicine. I have lot of patients for those people. So you can do that thing.
There's a question, biochemic and mother tinctures are not homeopathy. Should we practice them?
They are homeopathy. You cannot argue. And it is very useful. You can use it according to the need. There are some mother tinctures which give phenomenal result. Our calendula, echinacea, cretagus, digitalis. You need to use this Adonis vernalis. You need to use this. Some our kidney mother tinctures. You need to use it. Biochemic. You can use it.
I also use because we are not supposed to hide prescription from the patient. So many patients online consultations, you have to send the prescription. So if you are not able to prescribe Saclac, even in abroad countries, they prefer giving biochemic.
Okay.
To save their honor and to facilitate the action of homeopathic remedy. So biochemics, they are also homeopathic, and mother tinctures are also homeopathic. If you want literature about how mother tinctures are homeopathic, I have written an article on that. I'll share the link. There's a question, sir. I am in third year. What should I do? Whether I should join a hospital or a homeopathic clinic? What should I do?
Depends upon your aim. What do you aim for? You want to be a RMO doctor? You want to be a homeopathy doctor? You want to be a professional doctor? Then you should aim for that. आप लोग ऐसा ड्यूटी करोगे आरएमए का और फिर बोलोगे मैं होम्योपैथी डॉक्टर बनूंगा, ऐसा नहीं जमेगा. तो आपको यू नीड टू गो टू होम्योपैथी डॉक्टर, देन स्टडी अंडर हिम. Time is less. You are going to invest 4-5 years as an RMO doctor and try to be a homeopath? Never. Instead of that, you invest for 2-3 years to a good homeopathy doctors, under many homeopathy doctors, you will fly very high.
I would like to know from which homeopaths you have learned.
I have learned, first when I was in my graduation, at that time, my general aim was to become a 20 rupees doctor, a general practitioner. That was my aim in BHMS. बस उधर जाने का अपने को जनरल प्रैक्टिस एकदम ऐसा छोटा एकदम रूम लेना है, ऐसा 20-20 रुपए लेने का, 30 रुपए इंजेक्शन के लेने का, 20 रुपए तपासनी फीस. That's all. I'm happy. 1,000 rupees per day. वाह, मजा आ गया. I had that aim. But in second, third year, I saw some doctor, and she got some very good results. And I thought, yeah, she's charging on good also and getting good results. She's doing a good work. And then my father had some complaint. I took him to Shankaran sir, and then I saw Shankaran sir is doing very phenomenal work. And then I thought I should become a homeopath. Then I used to, I pasted all the homeopaths, Vijay sir, Nikam sir, Shankaran sir, photos in my room. I used to study. I had my aim after my internship. I would go to this doctor. I would go to Bengal. This. But I didn't go that much. I went to other song for 6 months basic course, and then I was attached with Gaurang sir in Mumbai for 6 months. In evening, I used to go with his OPD, and then he guided me. I went to Sangli, and then I used to go to various doctors there. I in Aurangabad also I used to go to a sir. So I have been to these places.
There's a question. The student is asking. Some people say that we should charge high because we took a lot of effort in taking case and to make a higher standard for homeopathy. What do you think about this?
Definitely. See, your charges are based on your need and your thought process. What type of patients do you want in your practice, and what number of patients do you want in your practice? What is the time frame in which you want to achieve your aim, your economical, your security game? And then according to that you can charge. If you want to charge 5,000 rupees fees and see one patient in 8 days, it is fine. There is no problem in it. The charges should be according to your need, your area of practice, your person, your people's paying capacity, and according to that you can decide it. If you are practicing in an area whose daily wage is 300 rupees, you cannot charge him 500 rupees. Okay, it is difficult. You cannot take a whole day's earning to your pocket. You have to analyze it according to your area and your need.
My next question was about what thing we should be focused about the practice.
See, yeah, very, very interesting. So we should focus on our patient. Every patient is a life changer. I tell you, I had some patients which have given me a lot of pickup. I cannot even imagine. So in every case, you should take a pinch to you, or you should get yourself focused. Bhai, idhar hi rahe, idhar hi rahe. So just focus on his ailments, his thing, and in whatever way you want, just give him result, and you will get whatever you want in your life. I guarantee you. हर एक पेशेंट ही भगवान है. वही हमारा जो भी है वो मीडिया है, वही सब है, वही सब है. बाकी सब कुछ फायदे का नहीं.
Any important tips you want to give to the beginners to start their practice?
Right, right. So for beginners, I'll tell you, you need to first survey your area. You need to just wander here and there, 40 kilometers radius in your area, and go. How are the patients? How is the doctor charging? Why one doctor is charging 50 rupees? Why doctor for 500 rupees? What is the class of patients they are getting? What is the number of patients they are getting? And how are the results? How are the patients recurrency? And how are the patient repeating or they are going away? And analyze yourself also. In what area you are confident? You may be confident in some skin diseases. You may be confident in some respiratory ailments. So focus on that area first, because your strength will more guide you more and get you good results. And analyze your weakness. So focus on those weaknesses and study those medicines, study those diseases, and get perfect in those diseases. Get all your diseases first. If you want to practice, get 100 common diseases or 50 common diseases, and get 10 remedies for each disease done. They should be on your tongue. इसका पेट दर्द कर रहा है, ऐसा दुख रहा है, कौन सा दवाई देने का. अभी आप लोग मेडिकल पे जाते हैं, वो दे गिव पैरासीटामॉल इजीली. तो आपके पास पैरासीटामॉल कौन सा है, यू डोंट नो दैट. अभी इसको बुखार आ गया, कम कैसे करने का. तो जब तक, unless and until we are going to know that thing, you are not going to become a doctor. You are just going to fantasy. So we need to analyze ourselves and learn. Early practitioner should invest his time more in learning, conquering his weaknesses. This is the time. एक बार patient बढ़ गए, your growth may stop, your learning graph may stop, because you will not get sufficient time. So now is the thing. When you are a beginner, invest your time in learning. Invest your time in various courses, videos, take your notes, revise them, and you need to do it.
There's a question, what about clinical conditions and how to master in that? Can you please name few 10, 15 clinical conditions? They'll prepare therapeutics.
Clinical conditions, you mean like disease, acute. So acute phases are fever is there, coryza is there, earache is there, colic, diarrhea, constipation. These are called joint pain. These are common ailments. Everyone has it. And for this thing, you need to have tip. Suppose a patient comes, he has right shoulder pain. You need to know the remedy. If you don't know the case, you need to prescribe something. Left shoulder pain, what is the remedy? Elbow pain, what is the remedy? If then he is having yellow coryza, we need to know the remedy. If he's having coryza and pain in sinuses, we need to know the remedy. Earache with yellow discharge, we need to know the remedy. So common ailments, 10 remedies for each ailment. Write it down, mug up, revise, practice. This will help us.
Do you use rare remedies in your practice?
Yeah, as I told previously, I use it, and it is according to patient. Now, suppose I had a patient, I brought tungsten metallicum for him. I brought anthracocali for that patient. She had lung fibrosis. So those patient, if a patient tells you those things and you analyze to a remedy and you don't find it, you need to get it. So focus on patients, and you need to be there. You need to analyze the case. Just be there.
Okay. We are towards ending the session. I would like to know about your struggles. I'm sure a good person, good homeopaths, they are full of struggles, hard times. If you feel comfortable, can you share some of them with us, all of us?
See, the first thing is about getting patients. Okay. And what I had an insecurity in my life is how will I earn money? Because it is a basic thing which we want in life, and to get bread butter for our family is a very important thing. And unless and until I get some patients, how will I thrive? So for that thing, I had done these various courses. I thought मुझे नहीं homeopathy जमेगा तो मैं ऐसा करूंगा वैसा करूंगा. But that remained all insecurity things and in cupboard only. I didn't had to take it out of that. And for to become a homeopath, I thought, yeah, I should take efforts. Unless and until I will take efforts, this struggle will not go. So from my second year, third year, I started seeing patients. कुछ भी किसी को कुछ लग गया मैं बोला अरे मैं दवाई देता हूँ. I used to buy medicine and give him from medical. Then some is having courage. अरे मैं दवाई देता हूँ खुद. I used to tell, I will give you medicine. And then tell everyone that I am becoming homeopathy doctor. I practice homeopathy. Just if anyone has homeopathy in my, he should know about me. I used to tell everyone. कुछ भी बोलो मैं दूसरे सर के पास भेजूंगा आपको, वहां भेजूंगा, बम्बई भेजूंगा, बट ऐसा करोगे आपको ना होम्योपैथी दवाई लेके देखेंगे. होम्योपैथी में बहुत बढ़िया पावर है. You should convey about the science to people. Unless and until you are having faith, you should, how your patients come to you. And then day by day it is about every day getting more efforts. I have written a short poem. I'll tell you. ये सेशन के पहले 10 मिनट में मैंने लिख दिया. To be a homeopathy doctor, you don't need an X factor. Okay, you can do it with simple sacrifice and mix your efforts in everyday's rice. Will thy achieve your fame? Public will cherish your name. Don't make money as your greed's shame. Keep it persistent. It's an easy game. So in that way, we can become a good homeopath. Okay.
That was so beautiful.
Yeah. So I want people to have ethics in their life. Make yourself accountable to what. If someone gives 1 rupee to you, you should be accountable to that rupee. And you should make justice to your patient. You should be empathetic to your patients. You should have your everything for that one person and just make his suffering out, and then you can be a healer. And this is a journey, my dear friends. Love this journey. Have efforts every day. Make your study as your priority, and everyone can become a good homeopath.
Thank you so much, boss. And it was a very, very lovely, very informative, very motivational session, I must say. And in just time constraint in 60 minutes, you have said something which can be, analyzed for the rest of the week. And thank you so much that with just a mail
to coming on your platform. You are doing a good job. I am seeing your followers. Wow.
They are more like my family, and I try to be, reply them, solve their problems, and educate them whatever I can. And even I learn from them. I don't miss a chance to learn. I'm very opportunistic. If I get a chance to learn from even a first year, second year student, I use the opportunity. Acha, he's saying something, she's saying something, and which is accountable. So definitely. And with just a mail, with just a messenger text, you are here. I mean, you're so kind, so down to earth, boss. And I have not listened to you this way. I have heard your videos, your rubric learning, everything. But listening to you live, it was such a treat to my ear and my soul. My homeopathic soul inside is very happy.
Thank you, doctor, for this opportunity. Thank you.
And you should make a promise that you'll come again. I take this promise from each and every guest that you'll come again on our talk, and we'll discuss about another big topic, whatever the audience, whatever the students want, and we'll discuss over that. Will you come again?
Definitely will come. Yes.
Thank you so much, my all dear family, the Homeopathy Heals family. Keep following. I'll drop feedback box. Do write us whatever you have learned. Even if you have a questions, our Dr. Raj Bondre is here to answer all your queries. You can DM him as well. And next week we'll be back with another celebrity of homeopathy. So stay tuned with us. Till then, stay fit, stay healthy, homeopathy.
Thank you.